So another common question is, after fat transfer surgery, is that result permanent? By and large, the answer is yes. By about the 6-week mark, whatever the fat has stayed there and is able to get adequate blood supply will stay with you for the rest of your life. However, just like a normal area of fatty tissue, it will fluctuate with your weight changes. If you were to gain weight after a fat transfer surgery, because the fat transfer area is now an area of high density or high concentration of fat cells, it's going to be one of the first areas to visibly get large. Now, when you lose weight, it will also be the opposite end of the spectrum, where it will be a very stubborn area for the volume to decrease. However, it still can. So to answer the question, by and large, if your weight is stable after fat transfer surgery, what results you have at 6 weeks should be permanent for the rest of your life. So how much fat does actually survive after a fat transfer surgery, whether into the buttocks and the hips or the breast? Now, this depends on a lot of factors. So first of all, the patient's anatomy. Now, when you do a fat transfer, you're relying on new blood vessels forming into those fat cells to be able to supply the fat with oxygen and nutrients for it to survive and live in that area and call that area its new home. It's very different to putting a prosthesis like a breast implant, in which you don't need any blood supply. So when you do a fat transfer to the back of the bum, in the buttocks area, now because there's a large glute muscle right underneath it, the fat is able to get very good blood supply from there, and typically in my experience, about 80% of the fat will survive. However, in the hips, which also is part of the fat transfer in the gluteal hip region, fat retention is a lot less. It's more like about 50%. And the reason for that is under that area, there is no muscle under there to directly send blood vessels to above fatty layers. You're relying on blood vessels coming from the top part of your quadricep muscle and the outer parts of your gluteal muscle to send some blood supply. So that's generally about 50%. Now in that region, the other big factor is the amount of space that the patient has. If the space is inadequate and we try to overfill the area just for the sake of getting more fat in there, inevitably, because the pressure is so high, it's going to be very difficult for blood vessels to form and hence a less survival rate. And the big thing is obviously after a fat transfer to the buttocks or the hip region, you can't apply any pressure to the area for the first 6 weeks. The compliance of this on the patient's behalf is one of the biggest factors in determining how much fat will stay there long term. Okay, so what does weight fluctuations do to your body after liposuction or fat transfer surgery? So when your weight's going up, essentially you're in the calorie surplus and all the fat cells in your body are slowly getting bigger one by one. So what that means is if you had an area of fat transfer where we took fat from other areas and put it into a specific area, breasts, hips, buttocks usually, those areas now are an area of high fat cell density. So when you gain weight in that state, those areas that's received the fat transfer will be the first areas that you visibly see getting bigger. So breast, hips and bum after weight gain. Now, what about the areas that you did liposuction? So those areas where you took those excess fat cells from those areas, they do still have fat because you do need a little bit of fat under your skin. You can't literally get 100% of fat out under the skin. Those areas with weight gain, yes, those fat cells will be getting bigger too, but because there's so few of them, it's going to take a lot of weight gain for there to be a significant change in the actual visual appearance. Now, conversely, if you were to lose weight after liposuction and fat transfer surgeries, the areas that you did fat transfer, they will be the most resistant to change. So after fat transfer to the hips and bum, if you were to lose weight, yes, they will go down as well. But relative to other areas of the body, they will be one of the last areas to visibly get smaller. The difference between fat transfer to the breast and breast implants. So they're both methods that can be used to enlarge the size of the breast in a female patient. However, they are very different. So obviously with an implant, it is a prosthesis, a foreign body going in there. However, with the fat transfer, we're just using a natural fat to increase the size. Now, there are a couple of limiting factors when you're considering a fat transfer to the breast. First of all, you need to have adequate amount of fat from other areas to be able to give that kind of size increase that you're after. And fat transfer to the breast, typically, retention rate is about 50%. So if your breast is able to accommodate 600 mils of fat initially, you can expect to have about 300 mils of fat remaining at the 6-week mark, assuming you followed all your post-op protocols perfectly. However, even at 300 mils of total volume of fat remaining long term is going to be very different in shape, size to a 300cc implant. So all in all, the look that you can achieve with a fat transfer to the breast is very different to an implant. Now, most patients who are looking for a fat transfer to the breast are typically looking for upper pole fullness and a bit more medially for increased cleavage. What is involved in the aftercare after a BBL or a fat transfer to the buttocks hip surgery? The most important thing is we want to get maximum retention of the fat. In order to do that, you can't apply any pressure to the buttock or hip region, which means you have to sleep on your tummy, you have to eat standing up. The only 2 times you can sit are when you're going to the toilet and when you're getting into a mode of transportation, car or a plane. So when you go into the toilet, you sit mostly on the back of your hamstrings, try to lean forward, just try to minimize the pressure on your buttocks and essentially just make it quick. Now, when you're getting into a car or a plane, you use something called a BBL pillow. This firm foam pillow goes in the back of your hamstrings, so your bum is going to be suspended. Now, just because you have this pillow does not mean you can sit on that for all day, 10 hours a day. It is just literally when you're getting into a car, when you're getting into a plane to go back home. Now, how long to do this for? The first 2 weeks is the absolute golden period, but I tell all my patients, you're going to be off your bum for 6 weeks. After 6 weeks, you can do whatever you want to do. You can catch a long flight, you can sit on your bum for as long as you want. And I encourage patients to start exercising and do everything normal from 6 weeks on. But you just have to be good during the first 6 weeks in order to get the maximum amount of fat that's going to stay in that region for the rest of your life.